Okay. Hi, everybody. It's great to be with you. As Dinus mentioned, I've been in global health for a long time, and about almost 2 years ago, I just decided to go all in on AI, and I've been obsessively learning about AI, using different tools, testing some things out, doing different projects. Started doing some research on AI and community health worker programs in LMICs. I did a mapping. Now working with a team on a scoping review and also planning some field research in a few countries that are leading the way in this. So have really dove in and learned as much as I can. And I approach this from the point of view is that I'm a global health professional first, and I'm learning this and trying to figure out the ways that AI can be most helpful to people like me and you in our work. So not approaching this from a technical point of view, a lot of what we hear is sort of intimidating because the technology is quite intimidating. But approaching this sort of from the level that where we are and how this can really practically be used. So I'm going to cover three levels here. So the first part will be at the individual level. So for each one of us as global health professionals, what are the skills that we need to learn, and then how can we best use these tools? And then the second one, looking at organizations and how organizations can start planning and building AI into their systems. And then finally, how AI is being applied in global health in the field. And then running through that, talking about some of the limitations of the technology, risks, and responsible and ethical use. So, first off, when we talk about AI, a lot of people now, I mean, AI mostly came into our consciousness when ChatGPT was launched, and a lot of people still think, ChatGPT equals AI, AI equals ChatGPT. But actually, ChatGPT is just one type of AI. So we have the umbrella term AI within that, and most of the AI that we use today is based on machine learning. And machine learning basically is systems that learn patterns from data. So instead of following coded tools, so like most software we have is hard coded, it has rules, and it does whatever is coded into it. The difference with machine learning is that it sees a bunch of data and it learns patterns from those data. And then within machine learning, there's computer vision, which enables machines to interpret images and videos, natural language processing, which allows them to understand and work with text and speech, and then generative AI. This is what LLMs or ChatGPT are generative AI, and this is creating new content. So generative is generating new content like text, images, code, videos, etc. In global health, we talk about AI can mean a lot of different things. So we might use it for reading chest x-rays to screen for TB, or doing predictive analytics, or using a chatbot like ChatGPT. So they're all different technologies and used differently. For this presentation, I'll mostly be talking about generative AI. In the global health section, I'll talk about some of the other tools, but when I talk about AI in general in this presentation, I'm talking about generative AI and the large language models, or LLM. So a few misconceptions about what AI is. So AI doesn't really know things in the same way that a person knows things. What it does is it learns patterns from its training data, which is basically billions of pages of text from the internet. Essentially everything on the internet, all the books, it's learned all of that data and it's seen millions and millions of different patterns within that data. When those patterns are strong, then it can produce really good output based on those patterns. But when they're weak, the output can be wrong. And the AI doesn't really know the difference of when it has a good answer and when it has a bad answer. It just gives you what fits its patterns that it's learned. So also AI is not deterministic. So what this means, this is like what I was saying before, regular software. It has programs, it has code in it that programs it. If this, then do this. If this, then do this. So you can give the same input to regular software 100 times, you'll get the exact same output 100 times. Generative AI is different because it's probabilistic, not deterministic. So this means It's a little different every time. So you can put the same question into ChatGPT 100 times and you'll get 100 slightly different answers. So we have to keep this in mind as we're using it. It's not a calculator. It's not like the software we're used to. It's something that's a bit inconsistent. And then third, it's not objective. So again, it's just reflecting what it learned in training data. And that training data is the internet. It's everything we have produced as humans. So our biases are passed on to that data and then passed on to the LLMs as well. So they have the same biases we do. Most of the input data is in English, mostly from high income countries. So this biases the data in that direction. Also, your prompts can bias the data. So if you lean a certain way in your prompt, then it'll tend to cause the output to lean that way as well. And then in trying to understand it, there are a couple analogies that I've heard a lot that you may have heard. The first being AI is just fancy autocomplete. So it's basically like in your phone, when you're texting or in your email, you start writing a sentence and it finishes the sentence for you. Essentially, that's true. The way they work is they look at whatever is there and they're predicting the most likely next word. So it is in a way like an autocomplete, but this really completely undersells the technology. All right. So in the sense of your phone or your email, when it's auto-completing your sentence, it's just doing that based on the previous few words. Whereas the LLMs, and one of the huge breakthrough that allowed these to be so powerful is that they don't just look at the last few words, but they can look at all of the relevant data at one time and see all of that context and then give you an answer based on all of that. And that was just a huge game changer. So then the other analogy is sort of the other end of the spectrum is that it's a genius. It's a genius who knows everything it knows everything about everything. And again, this is partially true. It does know a lot about almost everything. So it is amazing in that way. But then it also has mistakes and limitations that a genius human wouldn't have. So for example, a genius human will know when it doesn't know something, but the AI doesn't necessarily know that. A person wouldn't produce totally confident but completely wrong answers, but the AI will. And there are certain tasks that seem totally basic and easy for us, and the AI just fails on those. So it is sort of like a person, and I think usually using it, it's helpful in some ways to think of it more as an assistant than just a software, but that also breaks down in certain ways. So the most helpful way that I've found to think about it is a model. So most of you have probably worked with models, disease models, epidemiological models, climate models. They basically work by taking an input, they do calculations, and then they give you an output. The LLMs are similar. The data input is, again, everything that they've learned on everything from the internet, plus whatever information you give it. The model has the learned patterns that it's from its training data. And then it will go through, look at those patterns, and then the output is the text that it gives you based on those patterns and its settings. And the magic in these really is scale. So I think it's hard for us as humans to understand things on a huge scale. And the amount of information that have gone into training these models is at that scale that we can't quite wrap our brains around. So it's hard to understand, like, how can it be so good? The answer is basically it has just had so much training data that it understands these patterns so well. So sticking with that analogy, on the left is an example like the LiveSave tool that some of you have probably worked with that is modeling the effect of interventions on health outcomes. So here, if we look at an input into list would be estimated coverage of interventions, say for childhood mortality. And then it does the calculations based on the intervention effect sizes, the settings, basically. It's been programmed in that these are the effects of these different interventions based on the available evidence. And then the output, it gives you an estimated effect on mortality. And then on the right is an LLM. And basically, again, the input is training data, any web search it's done, any information you've provided. It calculates the most likely response based on its settings or model parameters that people. So this is what the companies do, OpenAI, Anthropic. They're they're setting parameters for all of these. So, weigh this relationship more than this one, etc. And it gives you a text response in the outcome. And I use Claude to make this little model to sort of hopefully make this a little more concrete. So on the left is an example like the list model. So we're looking at what are the effects of these different interventions on under 5 mortality. So we have measles vaccine coverage. So this is our baseline, 50%, 30%, and the estimated under 5 deaths. So we could say if we increase measles vaccine coverage to 95%, then mortality went down to 74. Now, if we increase ORS to 90%, now we're down to 67 deaths. Breastfeeding, now it's down to 65. Antibiotics for pneumonia, now it's down to 60. So we see how the model works, right? We change our estimated coverage, and that the model calculates the difference, and we see the difference in mortality. So with the LLM, it's a similar thing. The three main things that go into its decision making. One, your prompt. So what are you telling it that you want it to produce? And the more specific your prompt, the more specific and detailed the output will be. So here we're saying this is a super vague prompt. The second one is training data relevance. So this is all of that information that it was trained on. How relevant is that data to whatever question you're asking? So if it's not relative, it's not going to be able to answer your question with any accuracy. If your question is very related to its training data, then it'll give you a very accurate answer. And then finally, context. So whatever context you provide about your situation, your country, your program, whatever you're working on, you have a lot of context that may not be in all of that training data. So if we hypothetically then, we're basically at 0 now, our results, accuracy, relevance to your question, and completeness of the answer, those are all very low right now. If we make our prompt really specific, we get a counterintuitive result. So one, completeness has gone up because we've asked exactly what we want in our answer. So the answer now is more complete. It covers what we asked. However, we saw accuracy actually go down when we turned up specificity. So why would it do that? It goes down because now you're telling it more about what you want. So you're saying, I want to analyze this data. Give me calculate all of the indicators, all of the results for this data. I want to analyze the text and give me quotes from the data, give me references and citations. So you're asking for all this stuff, but it still doesn't have the answers in the training data, and it doesn't have your context. But you've told it to provide all these results, and it will try its best to give you whatever you ask for. So you ask for all these things, but it doesn't have the answer. So it's making all this stuff up. So there's a lot of hallucination. So that's why accuracy went down. But then we increased training data relevance. So now we're asking a question that's very relevant to what it already knows. Okay, now our accuracy has gone way, way up. Completeness is up, but relevance is still low because we haven't told it about our specific situation, our program. So if we add in all the information, now this is our context. We're operating in these districts, in this country. Our program provides these. These are the cultural elements in this area. All that detail that's not in its training data. When you provide that, okay, now relevance goes up, accuracy is good, completeness is good. So hopefully that helps you just a little bit understand what goes into the thinking and how all these three different factors go into this. Okay, it looks like the poll is ready. Do you want to do that, Dennis? You want to do the poll now, Dennis? Okay, I will. I'll keep going. So then another thing I wanted to touch on is agentic AI. I think we hear a lot about AI agents, agentic AI, but it's not so clear what this is. And it's actually simpler than I think most people explain it. So basic non-agentic AI basically is just you ask a question, the model looks at its training data and it gives you an answer. That's its basic function. Agentic AI is any time that the model is going out, carrying out tasks on its own and using different tools to do things. So at the most basic level, we can think about searching the web. So when you ask a question and the model goes and searches the web to give you an answer, that was a simple example of agentic AI. And then a bit more advanced is you ask a question, you say you write a report about this, it goes, searches the web, collects all this information from different websites, puts it together, summarizes what it finds, and then writes it in a Word document for you. That was an example of agentic AI. So it's not just generating text, but it's taking all of these actions. So we've all used agentic AI already, but then when people are talking about agentic AI, they're often talking about more complex AI. So that's basic agentic AI. Then it just gets more complex. So we have multi-step tasks. So reading, writing, revising something, running code, doing checks, all of these things at more advanced levels, you can have models that are going and working on their own for hours, collecting all this research, putting it together, verifying, doing fact checks, pulling out data, putting it into a spreadsheet, analyzing the data, giving you a report. So that's an example of more advanced agentic AI. And one thing to note on this is there's that break, executing all these steps, and then it goes to the output. Again, it's still a probabilistic tool. You don't know exactly what you're going to get, so that human verification step is still really key. And we do still need your judgment. Maybe at some point it will get to where it doesn't need us to do these things anymore, that it's not making these mistakes. But where we are now, even the best models still make a lot of mistakes. So human judgment, expertise in reviewing these things is still very important. Okay, so that was sort of the intro background of how AI works. Hopefully that was helpful a little bit in understanding what's going on. So now we're going to cover the first pillar of individual AI skills. So I'm not going to spend a lot of time here. I think you're all aware of these different tools. They do fairly similar things. Some do some things better than others. Personally, I use Claude for about 95% of my work. I use either Gemini or ChatGPT for images and video, and I use Perplexity for web search because it's sort of tuned. For every question, it goes and searches the web and gives you citations with the answers. So I like that when I just try to answer questions from the web. And I think Claude, ChatGPT, or Gemini, any of those are really good for general purpose, complex tasks using for your work. And the skills we'll talk about today apply across all these tools.
Ned,
Yes.
let's try to do the poll now,
Okay.
if possible. Okay. Do people see it?
I can see it.
And the participants see the poll? Anyone in the chat? Yes, you see it. Can you respond? Please go ahead. Don't see any responses. Okay, coming. Coming. Okay. Coming. Mhm. Okay. A few more people responding. Okay. A number are done. Okay. Okay. We're at 70% response rate, so I'm going to end here. I think we have a good sense. Let's see the results. Can you see the
Okay.
results, Nate?
Yep. Thank you. Yeah, so I just like to do this little poll to start out just to see where people are and see if things are changing over time. Definitely a lot more people are using these every day. So now we have a majority. We're using web search, image generation, voice mode, not many, model selection, very few, canvas artifacts, projects. Okay, so small minorities using most of the tools. Barriers, lack of knowledge or training is the biggest. Privacy and confidentiality. Top priorities, how to use it, accuracy, safety. Yep, good. Okay, great. Thank you, Dennis. That's helpful. And it gives me a good sense. And I think it's always good to know that when I present all these tools, usually most of the people haven't used them, aren't really aware of them. So I think this should be helpful. Okay. So the first thing, when you decide on your platform, so again, you can use ChatGPT, Claude, Gemini. I'd say pick one of those three as your primary. I know a lot of people have Copilot with their work, and that's the one they're permitted to use, which is unfortunate because it's not as good as some of the other platforms. So also maybe you can think about dividing your work into what's really sensitive you have to use in the approved one. And then for other work that maybe requires a lot of thinking, but you're not inputting any sensitive information, then you go to Claude or ChatGPT or Gemini. So when you start using one of these, the first thing is just setting up your tools. So there's more to it than just logging in and typing in your question. There are other ways that you can sort of affect the settings and give it more information that will make it work much better for you. So first of these, there are custom instructions. So I think most people haven't done this. If you go into your settings in whatever tool you're using, you have custom instructions. You can type into a box there, and these apply to every single conversation that you'll have with the tool. So you don't want to put everything you want like for one project in there. You want something that will apply to every conversation you have. So maybe telling them basically who you are, what you do, what your job is, how you want it to communicate. So I tell mine to be like very direct, very honest. Don't always tell me that you think I'm right. Don't tell me that I'm such a genius. Just give me your real opinion, push back on things. A writing style, so I do a lot of writing using AI, and generic AI writing looks like generic AI writing, and nobody really wants to see that. So you can work with it and give it a lot more information about your writing style. You can give examples of your writing. You can think about how you want your writing to be. I make it sort of short, clear sentences, etc. If it's task specific, then you can give those instructions elsewhere. These are the ones that shape every interaction. And again, going back to how it's probabilistic, these instructions are a nudge, not a guarantee. So, there are certain things I tell it not to use the M dash, which is the cliche thing of AI writing. I have in several places I say don't use an M dash, and it still pushes those M dashes in there. So it's not perfect, but it's much better. Then the next thing is memory. So you can turn on your memory in your settings, and this will allow it to learn about your conversation. So it remembers things from your conversations, and it builds up more context about you, what you do, what you've talked about. So it just gets a little bit smarter and knows you a little bit better every time. Next is model selection. So this is a super, super important one that most people don't do. If you're using the free version of these tools, I think it won't let you do model selection. And maybe people don't even know that there are different models. So there are sort of tiers of models. The basic one is the really fast one. So I think in ChatGPT, they're fast and thinking models. In Claude, you have Haiku, which is the fast, smaller one. Then you have Sonnet, which is the medium one, and then Opus, which is the strongest reasoning model. The reasoning models are basically designed to think about things before they answer and check their work and think about, are they thinking about this the right way? And so they really go through a process of thinking about it. And so the results are much stronger. So any more complex work you're doing, anything that really requires some thinking, I always use the highest level reasoning model. So if you're just going to the free tool and you're typing in, help me brainstorm this, and you don't like the results, it may be because you're using the weaker model. There's a huge difference between these models. So I do think if you want to use these for real work, and I think everybody should because they're very powerful, it's worth paying $20 a month. Get a subscription for one of these tools and use the best models, and you'll see the difference. Next one is web search. So they do all now do automatic web search. So when you type in a question or ask for a task, the model will think and say, does this need web search or not? If it does, then they'll go and search the web automatically. But that's not perfect. And a lot of times it won't search the web when it actually should. So there's a setting you can click web search on. So I would do that. And then if it's really important, like I wanted to do something that I need really up-to-date, accurate information from the web, I'll just say, search the web, give me up-to-date information as of May 2026 on this topic. And then it will automatically go search the web instead of only answering from its training data, because it will always want to default to answering from its training data. Okay, prompting. I'm not going to spend a lot of time here. I think most people have probably heard about prompting and prompt engineering and how to get a good prompt. Basically, the summary is if you give it a vague prompt, you're going to get a very generic answer. If you give it a really specific prompt, you give it information, then you're going to get a much better answer. The keys of prompting are basically tell it the task you want it to do, specify the format you want it in, tell it the audience for this, give it any constraints, So in scope, time period, length, tell it what tone you want and how to structure the output. So those are the basics of prompting. You've probably seen lots of things on the internet, 10 prompts that change everything. And I think these are sort of a waste. I mean, it's tempting to collect all these prompts but then you'll never use them. And there are better ways, especially with reasoning models. They're much better at thinking through the things and giving you a good answer, even when your prompt isn't the best. And I think there's a better way to think about it than prompting. So one of them is context. So I mentioned this in the example of how they work. Context is if your question is related to something that's not about the general world, it's very specific to your program, to your country, to whatever niche thing you're doing, then you have to provide all of that context. And then it's grounded in your data and not just pulling out generic data from the internet. One is hallucinations. I think everybody's aware of this as well. And I mentioned this. This is, a feature, not a bug, of how these LMs work. Because again, it's not knowing something. It's not going to a knowledge base and getting the answer to something. It's pattern matching. It's giving you what it thinks is the most likely answer. So these hallucinations are sort of built into this technology. And there are ways to address this and significantly reduce the probability of hallucinations. So one, again, good prompting. Using a reasoning model will reduce hallucinations. Asking for sources for every factual claim. And then I even like to ask for direct quotes from the source that informed whatever fact is in what it gave you. And if you ask for that, if you ask, give me the direct quote, sometimes it will make up even direct quotes. But usually if you ask for a quote and it's made something up, it'll tell you. And then breaking it up into pieces. So if you say, I need a report on this topic and go, and it writes you a 20-page report, it's probably going to have a lot of mistakes in there because it's not so good at doing this huge task all at once. So better to break it up into pieces. So everything I do, I go section by section. The next, again, grounded in sources. This is giving your context and also telling it to search the web. Make it check its own works. There are a lot of different ways to do this, but you can, as I said, you can make it quote the exact passage. You can tell it to rate the confidence it has on each claim. And then it'll be more likely to say, okay, low confidence in this claim, and you can go check it. And then also I like to take a final output and I give it to a different model and tell it to fact check this. And it will often find things. And then I kind of go back and forth between them and you can usually get to a truth. And then finally, the final backstop is always you. Again, your name is going on this work. So I think you have to approach it like that and check things yourself. It's really good to have an expert checking something. If it's something you don't really know much about, it can be hard to figure out what's made up and what's not. If you're an expert on this, then you spot the problems. Any facts, statistics, citations are really like the most likely things to be fabricated. And also anything time dependent. So anything that needs up-to-date information, it's quite bad, I find, at searching the web and getting up-to-date information unless you really specifically tell it. And then checking that it actually says what the source is. So it might give you a correct source, but then it doesn't say what the source actually said. Okay, so then thinking about prompting, I think it's better to shift the way you think about prompting. It's not you give a question, it gives an answer. It's you have a conversation about this, back and forth with it. There are a lot of different ways to do this. So one really interesting one is having the model ask you questions. So I'll tell it what I want to do. Here's the background information. And then I'll say, before you do this, ask me any questions you need to know to be able to give me the best answer. And then it'll come and it'll ask you several questions. And a lot of times they're questions that you wouldn't have thought to provide, but actually are important. So that actually helps give you a much better output. The next one is meta prompting. So this is basically having AI write the prompt for AI. So I may go through this, having an initial conversation. It asks me questions, I answer. We go through this, and then I say, okay, write me a great prompt for this for AI. It'll write a really good prompt. I'll open a new chat and I'll put that prompt in and then get the answer. And then iteration. So it's really a back and forth. I think a lot of people make this mistake of going in, asking AI to do something. It kind of sucks. It's very generic, and they say, this is overrated. AI is not that great. It's just not the way to use it. You have to go back and forth, brainstorm, discuss. If you don't like the output, it's not what you wanted, you have to tell it. You have to clarify, push back. After all this back and forth, that whole conversation, in essence, becomes your prompt because it remembers all of this. So now you didn't just put in one prompt, you had a whole conversation. Now it knows all of this. Now you're getting really strong answers. We spoke about sycophancy and how AI will always do what it thinks you want it to do. So if you give it, oh, I think CHW program in Kenya is more cost effective than facility-based care. That kind of question, it's 90% is going to agree with you. So you always have to watch yourself and try to be neutral in these. I think we'll skip this because time is probably getting a little tight. So putting a lot of this together, when I write, I'm doing research and writing with AI. This is generally my workflow. So one, setting the rules. So, what do I want? What are the writing requirements? What's the formatting? Giving it all the context and examples. Then doing web research. And there are a lot of details that I won't get into now about how to do web research really well. And then, sorry, load your sources, do research, then I build the outline. So I have the basic information. I'll go back and forth with it and build a structure for how we want it. And then go section by section, drafting. So I'll say, what I want for this section. We have the outline. It'll give you a draft. Verify it, check everything, fact check citations, read everything, go back and forth. When that section's done, you go to the next one, etc. When it's all done, I'll do another round of fact checking. And there are various methods for this. And then a final read through. And then, yeah, putting it through another model first and then the final read through. So in knowledge management, a couple tools. A lot of people, I think, use NotebookLM, which can be super helpful for loading all of your documents, and then you can chat with those documents, basically. So I did a literature review years ago on CHWs in humanitarian settings. I've put all of those source documents, and update it, put those into NotebookLM. So now you can go in there and ask any question about that whole knowledge base, and it will give you answers. And it gives you interesting output, podcasts, video overviews, mind maps, study guides, etc. But what I really use, what I think is even more useful, and I use every day, I do almost every serious work task in projects. So in ChatGPT or Claude, you can do projects. You open a project, you name it, you give it instructions for whatever this project is for. You upload all of your documents for that project, and then you can have multiple chats within that project. And everything you uploaded now is context for every chat, not just, you don't have to upload it every single time. It's always there. And there's also memory across the chats. So now, if I do one part of it in one chat, then the next, if I'm switching to another part, I'll start a new chat and to do the second task, but it still knows what we did the first time. So it can always go back and check it. And I can say, remind me what we came up with about this in the previous chat. It'll search and it'll find it. And then it really gives you a lot of more useful output. So it can build documents, it can build slides, it can do spreadsheets, charts, it can build apps, websites, I mean, all kinds of stuff. So it's really, I think NotebookLM is actually more limited, and doing something in projects is just much more versatile and powerful. Also, just very quickly now, AI is inside a lot of the tools you use. So obviously the Microsoft tools have Copilot. Claude, you can also install a Claude for Word, Excel, PowerPoint. I actually think the Claude one plugin is actually much better than the Copilot one. So I've installed Claude in all of these. If I'm working on a PowerPoint, you can just go into Claude and say, when you're in there, say, check this, is this true? And it'll give you an answer, and you say, okay, go through every slide and add this thing to every slide, and it'll go through and do these for you. Google Workspace, Gemini's in there, and then a lot of other tools, softwares you have, they're putting AI into all of those. You can also connect your AI to other tools. So if you go into your settings and there's something called connectors, and you can link all these tools. If you want to connect your email, your calendar, your Slack, your Canva, and now you can use all of those tools in your AI. So you can ask your AI, search my Gmail inbox and see, and give me a summary of all the conversations I've had with this person, for example. So it makes it much more powerful. Now it's not just the chatbot, it's your chatbot and all these other tools. Obviously, it makes images. So I think most people had used images. So I did this image in ChatGPT. You can basically, these are things that a few years ago we were paying design companies to create these community education materials, etc. And now you just type in what you want and you get it in a minute. Videos as well. So I just made this little video of an example of how to measure MUAC for a child. So pretty cool. That would have been like days of work to go film that and edit it. And then you can use voice. So I think a lot of people aren't aware, but there's a little voice button when you go into ChatGPT or Claude, and you can just speak to it and speak back and forth. It works in lots of different languages. I'll practice Portuguese with ChatGPT. And with voice, there's a tool called WhisperFlow, and it's an AI tool that allows you to dictate. So if I'm doing a lot of writing and back and forth, I just dictate everything and then it types in the text and does it for you. So it works a lot faster. Translation. So yeah, it works in lots of languages. So you can translate documents. It's quite good now. Drafting, if you want to, write in your native language and have it translated, or if you want to just have it written first in a language that maybe isn't your native language, it can do that for you. We're basically real-time interpretation is a technology we have now. It's not quite available everywhere, but I would say within a year or two, it's going to be available and we'll be able to travel somewhere and just have a conversation with somebody getting instant translation into our headphones. And one thing to keep in mind with this multilingual work is, as I mentioned before, most of the training data is in English. So it really works best in English. And then in other high resource common languages, French, Spanish, Portuguese, Arabic, it's pretty good. And then when you get to languages that are used by fewer people in low middle income countries, then it doesn't work as well. So you have to be really careful and always have a fluent speaker check these before you send it out. Okay, so that is the individual section. So I think maybe we'll take some questions on that before we move on.
Yes, thank you, Nate. We do have just a couple of questions in the chat. I think the first one, there are actually a couple of questions within one question, so I'll just read them. So the first one is you say something about the training data relevance. Anna Ditchen asks, how does she know what the AI has been trained on and how to interpret it? And then where you mentioned the bias in the system towards English language and global North data access, how does one approach this in practice in interpreting the responses? And I think a related question that you could also address is the concerns about privacy. And when we talk about giving information, for example, from emails to AI, and then in those emails, there might be other information that we probably don't want to be in the public domain. So maybe you can respond to that before we go to the next one.
Okay, so the one on privacy I'll get to later, so I'll hold that one for now. The one on how to know if the training data is relevant to your question, I mean, one is just think about, is this a general question that the world knows about? Is there likely to be a lot of information about this on the internet or not? Or is it really specific niche data? So that's the first way that should trigger, whether you think how much you should trust the output or not. And then I think it's just seeing the output. And this is where being an expert in something really helps. Like it really is much, much easier to check AI output if you really know the topic. So then you'll be able to spot if this is like, oh, no, it's answering this question. This isn't true for my context. This isn't the way it is in my country. You know that. So I think it's those two, basically figuring how general is this question versus how niche, and then just looking at it and trying to spot whether it's relevant or not. And the other one was on English bias and how to know how to spot that as well, if it'll be good or not in a different language. Yeah, I think just trying it, basically. I mean, if it's a language you don't speak well and you're translating into that, then you need to have somebody who does speak it well check it for you. And if you do speak it, obviously, then you can check it. So again, I think it's the same answer, basically. If it's, the more niche or less used the language, then you should have more skepticism and it needs more checking. Any others?
Other questions? Yes. I think related to the privacy issue is the question about the ethics and the data confidentiality, and particularly in this time of geopolitical tensions for the development and humanitarian sectors. So how do we use AI confidently managing those risks?
Okay, let me also defer that one I have a slide later on privacy, and then if it didn't answer it, then maybe we can cover it.
Another question then. How do we balance the use of AI support communities with and how it affects the local communities that we work with as global health practitioners?
So yeah, that's a broad question. I don't know exactly what it's getting at. I mean, are we talking about affects communities in terms of data centers and things like that, or how our outputs would affect those? I mean, I guess as with any program.
Yes. Maybe let me add, because they used example of reported use of water and water quality as examples. So it's things that relate to how the community maybe is behaving or conducting itself.
So that sounds like with water, and so it's about environmental impact and data centers and all that. Yeah, I mean, I don't have an answer to those questions. I think these bigger ethical questions are really hard to know because so much of these things are changing and so much of it is future impacts. So in terms of like electricity prices going up and global, using more electricity and energy and global warming and water use, it's hard to know because you get a lot of different information about how much energy it actually uses, how much water it uses. The technologies are changing, so they are using less and less all the time. So what's true now might not be true in 5 years. So yeah, I mean, it's really hard to know right now. I would say maybe as responsible use is thinking I'll use this if what I'm using it for is a worthwhile purpose, for using a little bit more energy. If it's just a stupid thing and I'm making a bunch of videos as a joke, that's using a lot of energy for that. So maybe you can say, okay, I don't think this is worth it. If you're working on a program to provide healthcare, then maybe that's a worthwhile use. But I think each person has to think about those ethical things on their own.
Thank you. We do have a comment that touches on some of this. One of the participants says they see a huge risk in producing approximate documents such as educational posters and videos with errors that could have major negative impacts, and says the use of these tools should require an adaptation in approval processes.
Yeah, I mean, I mostly approach this as any tool. Like the output, anything that I turn in that I use the AI for, I see it as my output. And so just like before AI, anything that I produce needs to be correct. It needs to be safe. It can't have errors in it. And I think the same thing with AI. You're responsible for what you put your name on. So you still need to be checking it. It's just a bit more dangerous because it can produce so much so fast that it's a lot to check and a lot to revise. And there's also automation bias, which been seen with many other technologies and now AI. When you see that it's correct, 95 times, you're not going to check, you're going to stop checking it, and then it's going to be wrong 5 times. And it's really hard to check those five. So you need to put in place a lot of workflows. There are a lot of methods. I work a lot on trying to figure out, doing fact checking, checking citations, and doing these more advanced workflows. So it's really going and checking everything. And I have two models checking each other. So there are ways to find, 99% of the errors that will come. Okay, so maybe we'll move on. Okay, so the next one, getting into organizations and what organizations should be thinking about and doing. So we have the second poll. You want to do this?
See
This is
if we
just,
can pull it off.
this is just one question.
Can you see the poll?
I can.
This is just one question to get us through where we are in our organization. Thank you. Just a few more seconds. Is this enough, Nate?
Yeah, I think that's it. Okay. So the largest portion, no policy. 19% have some policy, no formal staff training. 17% have policy and training, but not built into tools and processes. 17% have everything basically. Okay. So basically 17% are really far along on this and vast majority have a long way to go. So that's good to know. Okay, so we talk about AI policies for an organization, and what does this need to cover? So first, data sensitivity rules. This is talking about these privacy issues and what can go into them, what happens to data when it goes into these tools. So the organization needs to think about this. What type of data are we producing as an organization? Which of that data is sensitive and needs to be protected? Which of it is harmless and there's no problem putting it into these tools? So for example, if you're doing anything with patient data, that's very sensitive, and there are laws in countries about how to handle this. Program data may be private, you don't want that getting out. Partner financials and research that hasn't been published yet. All of these things you probably don't just want to be throwing into any model. So mapping all these things out and telling staff, what's permitted to go into the general models, what can go into maybe Copilot that it has an agreement with, and what shouldn't go into any of them. So next, the approved tools and tiers. So again, for example, if you have Copilot in your organization, then that's the one that's approved. But again, what is that approved for? And then maybe you can use ChatGPT or Claude for some things, but not for everything. So which tools are approved for which things? Quality control. So as we were talking about, there's a huge risk of fabricated information getting out there. It can be really difficult to check it. It's a lot of output that's coming to check everything. So who's going to check it? How are they going to check it? What are the processes for this? And then disclosure. When do you need to tell your donors, your partners, a journal if you're submitting a publication, or your boss? When do you need to declare that you used AI and when don't you? And then accountability. Again, like I said, I always operate from the idea that whatever I turn in, I am accountable for. But then when you get multiple people using it and everybody's using AI and it gets a bit complicated, so who's accountable for what exactly needs to be detailed clearly. So on the privacy thing, so there are different tiers of privacy guarantees in these tools. So if we start at the lowest tier, basically this is you're using a consumer tool. So this means you're just an individual going and using ChatGPT, Gemini, Claude, and putting your data in there. By default, the setting is that anything you put in can be used to train the model. So that means in theory, say you put in a program report that is not supposed to be public. It's an internal program report. You want to ask the AI to analyze it, summarize it for you. You put it in there. Now that report goes to their data, goes to their training data. So a future version of that model, if somebody out there asks, who has done work on this topic in this country, your program data could come to them. So that's basically the risk that data can come out at some time to other people who are using it. Now, the second tier is you're using the same model. You're just an individual using a personal account, but you can go into your settings, and everybody should do this today if you haven't. Go into your settings, and there's one that says help improve the model, something like that. That basically means you're allowing them to train on your data. So toggle that off. So now they're basically saying to you that they will not use your data to train their models. So in theory, it shouldn't get out there. This is still not a contractual guarantee. This is a terms of service, and there's some legal difference between those. So you have some guarantee, but less strong guarantee than a contract. So the third tier is if you have a business or a team account. Now this is a commercial contract. You have a contract where they're saying legally they cannot use your data. It still does go to their servers. They hold it for some period of time. They have to have it for some time by law, but they're giving you a contractual guarantee that they're not using it. And then the next one is an enterprise account. So it's basically the same guarantees, but you can negotiate in specific clauses. So if you're using identified patient data, you need to be HIPAA compliant. You can negotiate that into your enterprise account. And then the fifth if really something is so strict that you don't want it to send to their servers. It needs to stay in your organization locally. It can't leave. Then you need to locally host your model. So basically that's using an open source model that you can download onto your servers and it runs on your computers and it never leaves. So that's the safest one. But then you need a certain data infrastructure to be able to use this. You need technical expertise, all of that. And one thing to keep in mind, besides this fifth tier of a locally hosted model, all of those are leaving your computer or your organization and going to the company's servers somewhere else. So in terms of verifying the work, some things to think about, differences between verifying work that was done by humans and verifying work that was done by AI. The major difference is with humans, you'd get a first draft. You're editing for quality, basically. It doesn't flow well, it's not structured well, it doesn't have some of the information you wanted. When you're looking at AI, you're basically getting what looks like a perfect draft as your first draft. So you're not looking for all those formatting things and structure as much, but you're looking to verify facts. These are two very different tasks. So think about, you don't want to just go and do everything at once at the very beginning when you're starting to implement AI as an organization. Start small, do some things that are, low-hanging fruit, cheap wins, low risk, high volume repetitive tasks that save people a lot of time, but are not going to be a huge problem if something, something hallucinates and there's some fabricated information. So we could have some quarterly donor reporting. I mean, you definitely want to check this to not have fabricated data, but it's fairly straightforward. And the AI is much better at taking numbers from here and putting them here. It's much, much less likely to make up those numbers in that transfer. It's much more likely to make up than something when you tell me, what's the percentage of children with this condition? Then that's a risky ask. If you're saying, I know the percentage, just write it in this format, that's pretty low risk. So first drafts of proposals, meeting summaries, translation of routine documents, summarizing, monitoring data, program reports, data cleaning, pretty good candidates to start with. Riskier things are, making clinical policy decisions, setting protocols, individual patient recommendations, ethical review decisions, legal contractual decisions. These are very high stakes. So you can start implementing those things when you have a better handle overall. And now I'm building organizational systems. So first is thinking about building some standardized prompts and templates. The things that people do over and over and over, you could save a ton of time by developing, a prompt or a template for proposals. We're always writing proposals for this. We have a certain format for this donor. We have a format for this donor. And you give it the information and it plugs it in. Now things that would take days can be done in hours. Pre-configured workspaces. So I mentioned the projects. You can set up projects. You can make these available for a team. You have all of the information in there. You put in all the background information about the program, the country, the health area you're working on, the background of the project. Anybody in the team now can go and use this, and it's all preloaded. Everything is in there. Makes it much easier to work together and saves a lot of time. Organizational databases. So now you can think about, I think a lot of organizations have these at UNICEF. There are these huge databases with all these organizations, but it's so unwieldy to use. It's so hard to use that it just sort of sits there and dies. Now you have one that can be kept up to date fairly easily. You can tell the AI to update this, and then anybody can go in and just query it in natural language. You don't have to go and find the exact report you wanted and go read the report, and it wasn't the right one. You go to another. Now you're just asking it questions about all of this knowledge base. So when people come and go, there's a lot of staff turnover. Now that information, that organizational knowledge doesn't have to leave when each person leaves. Monitoring and evaluating. So need to think about if you're implementing these AI systems, then we need to track what's happening. How are people using it? What did it do? Was it helpful? Did it save time? Did it save money? Were there quality issues? So really think about how to systematically evaluate how much it's helping you, how much it's not, were there dangers? And then, so I mentioned this issue of when you put something into ChatGPT, that data is then going to servers probably in the US. And there are laws in countries about cross-border data flows, usually applying to personal and health data. So this isn't all data, but sensitive data. There are laws about this. 45 out of 55 African Union member states have these laws in place. And so you just need to know what are the laws in the country where you're working, what kind of data is subject to these laws, and then if you're using that data, where is that going when you put it into AI? And in terms of organizational change, so really the most difficult part isn't the technology, but it's the people and the organization and getting people to adopt these different tools, adopt these different processes. There was a study that said 70% of AI adoption challenges are due to people and process, not because of the technology. And a large proportion of organizational AI projects fail. And this is mostly because of this challenge of adoption. And it's not so much an issue that people don't want to adopt it, it's more ambiguity about what they're supposed to do, how they're supposed to use it, what they use it for, how is it relevant to their work. So any initiative to roll things out, you need to think about all these issues and how to actually get people to use them correctly and understand what is expected of them. And, addressing some of the common questions, what is the source of people's hesitation? Is it they don't feel they have the skills? It's not clear what they're supposed to do, it hasn't been explained clearly. Maybe they have ethical issues with using it, or the fear of, there's still this idea that if you use AI in a way, you're cheating. So, if the organization does want to adopt AI, it needs to be made clear that people are encouraged to use it for these tasks. And then support from leadership. And are you able to build momentum without the support if you don't have leadership support? And starting small, running a pilot, seeing how things work small before scaling it up. And then we're going to move just quickly, not much time left, but just quickly going through some of the main ways that AI tools are being applied in global health and LMICs. Disclaimer, I'm not an expert in all of these programs. I've just done a little bit of research, but just to give a very quick overview. So there is a lot of activity, a lot of investment and ambition about these. There are a lot of different tools. Most of this is in pilot stages still. So there's only a couple things that are really scaling up at national levels. The one that's scaled up the most is TB screening, like the AI reading X-rays. And that's been deployed to 90 plus countries endorsed by WHO. Funding. So yeah, up to now, most funding has been for small pilots. Now there's a movement to give a bit more money to scaling some of these things. So there are a couple initiatives, both of them involving Gates, that are funding evaluations, large-scale evaluations of mature tools, or even starting to scale up things that have been proven. The strongest evidence is diagnostic AI. So I mentioned TB screening from X-rays. This is WHO approved. There are a couple of products that are very widespread now and have high sensitivity, specificity, generally have been shown to outperform non-specialist readers and sometimes more or less equaling specialist readers. And the other one is obstetric ultrasound. So it's basically just a handheld tool. A non-specialist health worker can then do this ultrasound for a pregnant woman. And a study in JAMA found that novice users basically were almost equal to credentialed sonographers for gestational age estimation. And with these tools now, the biggest impact of these and where it's also most needed in LMICs is where specialists are scarce. So this is really about not necessarily about replacing the doctors in the hospitals, but it's task shifting and extending some of this care out to the primary healthcare level. In disease surveillance, there are some examples of AI that scans news sources, social media, health reports for outbreaks, and it's reading all of this stuff and then analyzing. There was the example of Blue Dot, which flagged COVID 9 days before the WHO public alert by looking at social media and some health data and internet searches and putting all this together. This, of course, depends on data quality and completeness, which can be obviously a challenge in many LMICs. In Tanzania, there's an example where they put AI into DHIS2 for event-based surveillance, and they had a huge backlog of event-based surveillance reports because it took so long to read through them all. It would take 36 hours to process each one. When they put in the AI, now the processing is basically instant, and they managed to go process through the whole backlog, and now they get real-time alerts. And clinical decision support at the point of care. So a couple types of this. So one is predictive algorithms. So this is basically running in the background on patient data. So for each patient, you're putting in the data, what's the condition, how have they progressed, what are all their test scores. It will read all this data and flag people who are more likely to have a negative outcome, maybe people who shouldn't be released from the hospital. So being able to better triage patients. The second one is clinical aid tools. So this is where we have the health worker, even community health workers are using some of these AI tools. So when they're in an encounter with a patient, maybe they're confused about something, they don't remember the protocol, they're not sure what the differential diagnosis should be, they can give all the signs and symptoms to the AI, and it can give them the most likely response. So a lot of these tools are currently being tested. There are, of course, a lot of infrastructure barriers in LMICs. Most of them require connectivity. There are some offline tools, and that may be the way forward, especially for a community level. Health worker digital literacy. So most of it is written, but then again, with the voice-based tools, they can also speak to the AI, so they don't necessarily have to be literate. Language coverage, if they're not speaking in a major language, how well does the model perform? Not as well, but there are efforts to train local models. So training the open source models in certain countries on local languages, so then you have a good model that understands the local languages. And less trained users, I was mentioning the importance of expertise and being able to spot when the AI is making something up. The less trained the user, the less expertise, the higher the risk that these errors will pass by them and can affect, diagnoses and treatment. So a couple of interesting examples here. In Kenya, there was a Penda Health organization did a couple studies. The first one, they had AI that was basically answering questions and giving recommendations on diagnosis and treatment. And they found that 7.8% of those answers had harmful recommendations, and a large number of those recommendations made it into the final patient records. So the risk was real. It was giving some false answers that could affect patients. So they switched it around, and instead of the AI giving the answer, they had the AI just flag when it saw something that was likely to be an error from the clinician. And in this one, so the AI wasn't giving you any specific answers, so it couldn't make those mistakes, and it did reduce diagnostic and treatment errors. And then in Ethiopia, there was a system where the community health workers, the health extension workers, were calling to doctors whenever they had questions about a patient they weren't sure about. They would make a call, but they found that only 7,000 out of 18,000 calls were even answered. So either it's a connectivity problem or there was no clinician available to take the call. So the system wasn't working very well. So they made an AI system, and this one was actually a call center. So the health extension worker would call a human in a call center, and that person would query the AI, get the answer, and relay it to the health extension worker. Now, I think they're tweaking that so that the health extension worker can speak directly with the AI. And in Rwanda, there was a study where this wasn't actual clinical consultations, but they had questions that came from CHWs about previous consultations. And the LLM, and so they asked it to clinicians or to AI. And the AI significantly outperformed the clinicians on every metric and was 500 times cheaper per response than using and paying clinicians. So this is not actual deployment, but a benchmarking study that shows, putting those together, AI can make clinical assistance more available and can do a very good and accurate job. With health information systems, it's challenging because I think we know the challenges in health information systems in a lot of the settings we work. For the AI to work well, the data has to be good. So there's some of these with disease forecasting, looking at climate data, rainfall data, and then malaria cases, fever cases, putting all that together and forecasting malaria risk, for example, some for checking data quality and allowing people to query the health information system in natural language, which makes it a lot easier for non-technical people. One thing to point out, there's studies come out about the AI performed to this degree, but once you read that paper, that was probably 3 years ago, and the models have improved so much. So you just have to take that into consideration that the models now are probably much better than anything that has been tested and published. And again, the challenges of implementation, you need the infrastructure, you need the regulations, you need a trained workforce, and the challenge of getting from pilot to scale. A lot of equity issues. We mentioned the language issue, access to internet, urban versus rural, and even within organizations, the gap between training that goes to HQ people versus the field. So keeping in mind to not make this increase inequities. I think it has the potential to do both, either make things more equal or less. So we want to be conscious about that. And finally, to wrap up, so we've covered a lot, but it's just the tip of the iceberg. These are sort of the basics we covered. Obviously, they need a lot more practice, but then within that, there's so many more things you can do in your workflow that really change the way you work. And I think, most people have just seen the very, very tip of what they can do. This is true for personal work, for organizations, and for health systems. And so to wrap up, if you want to stay connected, follow the work I do a lot of writing about AI and global health and try to be really practical and teach things that are important to global health professionals. So I have a website where I publish all of that. You can subscribe. I post on LinkedIn. Oliver Morgan, I think, also has a good newsletter. And then I provide training and capacity building to organizations, teams, individuals. So if you want to go deeper and start doing this, feel free to reach out, and also advising, consulting on specific projects. So feel free to reach out. Here's my information. And I think we're about at time, but if we want to take questions.
Okay. Thank you very much, Nate, and some good comments. We are at time, yes, but just one question. You've covered it in some way. It's about the privacy, but also about how someone can protect their intellectual property in this day of AI.
Yeah, I think, any intellectual property that was out there to be collected before is gone. The world has access to that. A lot of people wrote books that now that information is out there and they didn't get paid for that. I think that is done. But anything you're doing now, it's following these privacy rules. Anything you don't want to be in open domain, you don't put into models where they can train on your data. So I think, the basic thing of turning off that allowing training on your data is the most important thing and very easy. And then the next thing is if it's more sensitive, then I would get a team or business account. Like if I work with clients, then I'm always doing everything on a team account. So it has contractual privacy guarantees.
Okay, thank you. Two other points. Someone wanted to know how you use AI in practice. So, for example, did you use AI to prepare these presentations? They just want to understand that. That's number one. A related question is, of course, there was an expectation that we might go into the details of learning how to actually apply, which is not possible in the 90 minutes, but you've shared your contacts. But where does someone actually go from here if they want actual practice with the different tools that you shared?
Yeah. So how I use it for everything now, honestly. I don't do any important work without using AI. And I think it needs to be, people often think, oh, it was done by AI or it was done by you. But there's nothing that I do that is done by AI or me. Everything is done by AI and me. So it's like you almost have a relationship, you're like a cyborg. It's me, but I am enhanced with all of this information, with all this capability to produce things. So yes, for this presentation, for example, I had an idea of what I wanted to present, and so I gave a rough outline, and then I brainstormed with Claude about the outline. We went back and forth. They gave me a lot of gave me some topics that I didn't think about, some details under topics that I wouldn't have thought about. I reject some of its ideas, I accept some, we go back and forth, so I have an outline. And then I use Claude to help produce the actual script and the background information and a presenter's guide. And then I built this slide deck with Claude as well. There's a new tool called Claude Design that is pretty great. You can build websites and apps and presentations and all of this. So I did all that. The images were done with AI, so I used AI for everything. And there are a lot more advanced topics. I build these verification tools for fact checking and checking citations and starting to set up a whole, like I call it an AI operating system. So you connect your AI, so I connect Claude to all of my information about all of my work. So now it has access to everything relevant to my work now and about me and about clients and projects. So anything I want to do, I think about, I could just ask Claude, what did we do with these other people that could relate to this one? It knows. And then it updates everything automatically. So if you say, okay, this project is updated, we have some new deliverables that we turned in, add this to the record. The AI goes and updates it. So it's in real time, it's updating. It knows everything. So now the AI is basically my filing and record system. So things like this, like it can get much, much deeper than how most people are using it. And so what was the second question?
Sorry,
What was
I
the,
think
there were a
we
couple.
yeah. I think we should conclude since we are past time, and we do appreciate the people staying up until this time. Shows the interest in the subject, and I do recognize that for some of the people who they were looking for more practical example, even practicing how to use the tools that are provided. I just wanted to say, first and foremost, I think we can all agree that AI does not replace you or me as an expert, but AI becomes a partner who is available at every moment for you to consult and helps you to speed up how you look through documents and summarize the information that you have and make decisions or choices. about action. I think that is important. But it is also important that we have to look for factual errors and biases. That is your role as an expert as you work with the AI. We all need training as the field evolves. And it is important to look up some of these resources. We can be champions as with anything when there is an introduction of a new tool. There are early adopters, and then there are those that are hesitant. I think there was a comment about what we do with those that are still hesitating. We can help them. And of course, the training, the organizational enabling is something that we all have to be advocates for by showing what difference AI can make. And I know we rushed through that last part, but you do have the examples. We are going to share the recording, so you can go over it and you see the resources. You can reach out to Nate if you want to follow up, and probably he'll point you to how you might get that practical training in the specific tools, and that is something that will be available to all of us. And as we have opportunity and the task force, we might have follow-up presentations where we go either in a specific tool or maybe in a specific case study example. And if you do have examples from your countries or from your programs where you want to demonstrate how you have used AI, that might be something that we could actually feature at another time. For now, I just want to thank you, thank Nate for taking the time to share with us his work in using AI, and as an educator, educating us on how to do this. And thank you again for participating, and reach out for any questions. We will, at a later stage, share a survey where we ask what the specific questions or points of training you might want to be addressed. And even if it is not the task force that might end up doing that, we could recommend to other people with the platforms and the ability to do this to support you. But I do hope that we all have learned something that we can apply to our work and be able to improve our programs or improve our own skills as individuals in our own professional development. So thank you very much.
Thanks, Ines. Maybe the last point on that, like where to go from here. One, I am thinking about putting together a course for individuals, so you can do it with multiple people. But then the main thing is, I learned all of this myself with AI. So if you don't know where to start, open up the AI and say, this is who I am, this is what I need to do. I don't know where to start, and it will give you a starting place and just go from there.
That's an excellent point. So AI can be our teacher and partner again in our learning journey. Thank you very much, everyone.